Okay, so I think the number one issue I've had lately, I've had a lot of lower back pain. That's at one point in time recently, it was I could hardly walk. It was really tweaked pretty good as far as my back, but it's gotten a little bit better, but I'm still having some tightness and pain in my lower back. Well, I've tried to do some stretching to try and make that better, to see if it's just the muscles that have tightened up that are pulling on the back, but I would say it's probably at a daily right now, it's probably at a 5 or a 6. It can get worse sometimes, yeah. There were a couple days last week where it was up to, I'd say, an 8 or a 9 as far as the pain level. And I think it would be my jaw. I've had issues with that for quite a few years, probably 20 years, with my jaw popping and making a lot of noise right in this area right in here. And it's been popping whenever I'm chewing food or anything, makes quite a bit of noise. And then occasionally, once in a while, it will, depending on what I'm eating, if I'm eating a real solid food, it will give me some pain in both of those areas right here. I'll get a lot of pain in that if I'm doing a lot of chewing. The popping's probably been going on, I'm guessing it probably 20 to 30 years at least, whereas the pain, I've only noticed that within probably the last 10 years. And then my shoulders, the tightness in my shoulders. I do a lot of work sitting in front of a computer, and my shoulders are kind of get real tight right in through, almost radiating up to the neck, but it's mainly down into my shoulders, where those muscles will really tighten up and cause a lot of pain. And that pain level can probably get up to, I'd say, an 8 or a 9. Well, I am working in front of the computer most of the day, so that's when it seems to be triggered from that. And I try to change my posture, or how I'm sitting, or how I'm set up as far as the functioning of using the keyboard and the mouse and everything like that. But that seems to be what's triggering it. I've just noticed occasionally, probably at least within the last 3 or 4 years, that sometimes when I get up real quick, the blood will rush to my head and I get a little bit dizzy. The top reason was jaw popping. So anytime that I was chewing food or even talking, sometimes the jaw on both sides would pop. One of them was worse than the other, but...
Which side was worse?
I think it was the left side was worse. So that was always constantly popping. Definitely anytime I chewed, it would be very loud. I mean, other people wouldn't actually notice it. And so it's been 100% improvement.
Perfect.
As soon as you put in the orthodontic originally, that all went away. At least over 20 years, at least when I noticed it. I mean, it could have started earlier, but definitely it was for at least 20 years or more, perhaps 30 years. Surprised that I would have the braces that long, but oh, well, yeah, that was amazing that, immediately as soon as that orthotic was put on, that all that popping went away, completely solved that problem altogether.
Then you chose the option, patient one, to move the teeth, bring it up where they should be, your own natural teeth.
Correct.
Instead of having an orthotic on there. That took a while. So how's it now?
Perfect. It's working great. No popping at all. There's no real tightness. I mean, I never really had my jaw lock up, but there was always tightness, like it could lock up. So that's all gone away. There's no popping, no tightness in the jaw at all. Okay. The lower back, I haven't had any problems whatsoever. I haven't noticed any pain whatsoever.
And how long did you have pain before, and how much pain compared to now?
Oh, it wasn't regular, consistent, but off and on throughout the years. And, since I've been seeing you being treated, I haven't had any pain whatsoever. Shoulder, all that pain has gone away. I used to have a lot of tightness in the shoulder and the neck, especially, always tightening up, feeling like I needed to pop my neck, or stretch it or something, and all that's gone away. I guess I just attributed it before to muscle tightness or strain, and I'd say it was probably off and on for, at least 10 to 20 years. I would say 98% at least, I haven't noticed that symptom at all since being treated. That wouldn't happen all the time, but certainly on occasion. I'd say maybe once a month, once every other month or something, I'd stand up real fast and feel a little dizzy, and I haven't noticed that at all. I'd probably say within the last 10 years. I'd say 90, 100%. I think I would have done it sooner. I actually had come to see you quite a ways back, and it was a significant amount of money to have this done and move forward. And so I had kind of delayed it and put it off, and then I finally decided I wanted to do something and came back. And it was, as I said, it was just absolutely amazing when I had the orthotic put in, the difference. It just immediately solved that problem with the popping and clicking in the jaw. And I still had to decide how to move forward after that. And obviously the orthotic was a cheaper option, but I really felt like I wanted to get something permanent done. Yes, it was a little bit of it was a commitment to get that done. It was several years with the braces on, but obviously it's well worth it to have it solved completely, permanently. So there was a few times I thought, what have I gotten into? I'm tired of these braces, but we persevered and gotten to this point, so I'm very happy. Well, I would definitely, the improvements that you're going to feel as far as the rest of your body and what's going to happen with this is well worth it. I think it's definitely something you need to consider. I mean, everybody has to think about their situation. It, wasn't something that I necessarily wanted to do at my age.
How old are you?
And I'm 61 now, almost 62. And yeah, that's not something I wanted to do, was wear braces at that age, and it took some getting used to, I'm professional working in an office, so, it's a little frustrating sometimes having those in your teeth and in your mouth, but it was well worth it to go through it and get it done. So I'd definitely encourage anyone to look at that to see if they can do it, because I think it's worth the effort to get it done. And I just really think that for me, my bigger concern is the problems that I was going to have weren't going to get better. If anything, they were going to get worse. So I thought I had probably better get it done now to eliminate that in the future, so there won't be worse problems.
You're thinking long term.
Yeah. Yep.
Well, thank you so much. It's a blessing to be able to help nice people like you.
Well, thank you, doctor. I appreciate it.